Hello, my name's Gail and I'm a pharmacist at Dr. Gray's Hospital in Elgin. I live in Dufton, but some of you might recognise me because I used to work in the pharmacy in Hopman and also the pharmacy in Burghead. So in the hospital, we mainly treat people that are sick and have had to come in because the medicines that the doctors at your local surgeries give them aren't going to work. So it's part of my job to make sure that the patient gets the right medicine at the right time, for the right reasons, at the right dose, for the right amount of time. Looking at maths in my job, it's really important that we're good at maths as pharmacists because we need to work out the right dose of medications for patients. So especially in children, a lot of the medications are per weight. So you might look at something being 50 milligrams per kilogram. So then if the patient is 10 kilograms, you would be giving them 50 milligrams for every kilogram of weight. So that would be 50 times 10, which would mean they would get 500 milligrams. Similarly, if they were 50 kilos, then we would give them 50 milligrams for every kilo. So that would be 50 times 50, which would give you 2,500 milligrams or 2.5 grams. So we need to be able to work out milligrams. We need to be able to work out how to change milligrams into grams, down to nanograms, to micrograms. We also need to be able sometimes to work out how much of a liquid will need to be given to give that dose. Another thing that we use a lot maths wise is that sometimes we have to work out doses according to how well people's kidneys are working. So mainly when you're given a drug, you get rid of it out of your body through your kidneys. So if your kidneys aren't working very well, then that can mean that the drug doesn't come out of your system and it builds up and then you can become sicker. So that's really important because the last thing we want to do is cause more harm to the patient. Another thing, sometimes we have to give medicine straight into people's veins because giving them it by mouth is not going to work quickly enough for us. So we give it into their veins, and sometimes we have to work out how many milligrams or grams of medicines we're going to have to put into how much liquid, and then we have to work out how quickly that liquid runs through the person's veins so that they don't have reactions to the medication, so that they don't get sick, so that they don't sometimes be sick from the medication if it goes into them too quickly. I really love my job, and my favourite thing about my job is that I get to help people to make them better, and then I can teach them, if they have to take medicines in the longer term, how those medicines will keep them better and help them to stay well. For my job, some of the main skills are really good communication. I need to be able to talk to the patients in a way that they will understand, but I also need to be able to talk to the doctors in a very medical way. I need to be friendly. People are sick. I need to be able to establish a connection with them really quickly. I need to be trustworthy. People need to know that I am not going to talk about their medical care and that everything is confidential at all times. I need to be professional. I need to be able to work with other people. I need to be able to uphold the highest standards to ensure that my patients are properly looked after and cared for. And most of all, you need to be caring. You need to understand that people are sick and that people need your help. And you need to care about the patient in order to help them. I am happy. If you have any questions, you can give them to your teacher, and they are absolutely fine to email me, and I can see if I can answer any questions that you send in my direction. But for now, thank you and bye.